Hi, I'm Jonathan Iman. I'm going to be your instructor for this year's Psychopharmacology for Therapists online course. I want to welcome you to the first video introducing you to the subject and giving you some basic foundational background. This class is not really something that you might have thought 10 or 15 years ago you would take to prepare for practice as a marriage and family therapist, since we're not allowed to prescribe medications. But maybe 10 years or so ago, the Consumer Affairs Board and the Board of Behavioral Sciences realized that MFTs and LCSWs need to be able to communicate clearly with clients and with doctors regarding issues relating to the prescription of psychiatrically active medications. So psychopharmacology is basically the study of medications that are used to treat psychiatric symptoms. And while we are not able to prescribe, and that is outside the scope of our practice, to recommend a particular medication or to talk about appropriate dosages or anything of that sort, we, in order to provide best quality care to clients, need to be able to help them understand their medications. We need to be able to determine when it's appropriate to refer someone to a medical practitioner who might be able to prescribe medications. And we need to be able to help the doctor be well informed as to how the client is responding to whatever medications may have been prescribed. So it really is a very important course, and I look forward to working with you to gain an understanding of how mental illness responds to different medications and how to help our clients get the best out of the biological intervention that is designed to help treat conditions that really are growing out of the confluence of biological, psychological, and social influences. Remember, the current paradigm of best description of mental illness is that it is the result of the interaction of those three factors. And so medication is a key part of the biological source of mental illness. It's also a key part of the biological treatment of mental illness. So we'll be looking at especially this biological aspect of the biopsychosocial etiology or genesis of psychiatric conditions. I'm going to show you a little picture here of some abbreviations that you'll see me using from time to time as I respond to your postings in the class discussions and others. These aren't my own symbols, but they're very commonly used. I want to make sure you understand them, though. So I'm going to put this up. Okay. And you see here SX is shorthand for symptoms. HX is the way we abbreviate history. DX is the diagnosis, which comes out of our understanding of clients' history and the symptoms they're presenting with. When we have a diagnosis, we make a prescription. Prescription in the doctor's case is probably medication, but it's never limited only to that. It could be a prescription for exercise, for more sleep. It could be a prescription for coming from us, taking steps to increase social interaction or skill building, rehab, something of that sort. So RX is prescription. PX is prognosis. What's our prediction of the future outcomes for this client? And finally, TX is the abbreviation commonly used for treatment. So you're going to see those symbols sometimes, and I hope that you might also find them useful in what you're writing and posting. So we're going to be working together to see a little more about how the medications that are commonly used now by psychiatrists and even in many cases by non-psychiatrists will be influencing our clients and working with what we do as therapists to help them develop more successful, better adapted lives in society. So we want to understand, as I already mentioned, that the etiology or the genesis, the source of mental illness, is a combination of biological, psychological, and social factors. And so the client's genetics, their upbringing, their way of thinking, their habits, as well as the social influences and the environmental factors all work together to sometimes bring to the surface a condition that we're going to diagnose as a mental illness. And so etiology leads to symptom manifestation. As we observe symptoms, we come to a conclusion of what the diagnosis is. That leads us to making a plan, prescribing some kind of interventions, and then the treatment is the implementation of those prescribed interventions. And remember, those interventions include potentially biological interventions, which could be medication, it could be exercise, it could be nutrition, it could be supplements, it could be a number of things. Some of those we don't prescribe, some of them we can prescribe and provide. It also would include psychological interventions and sociological interventions as well. So we want to give you some good solid background on the medication, or that aspect of the biological part of what we do as practitioners. So we'll be emphasizing the biological element, and while our specialty is in treatment, talk therapy especially, and we can't prescribe medicines, to provide the best treatment we need to be able to help our clients understand medication, help our clients be able to communicate with their doctors about their medications, and ourselves also communicate to the client and the physician regarding the use of psychiatrically active medications. Okay, so I'm going to end this introductory video right now. There'll be another one that will be posted soon that gives a little more information on the class itself, the assignments and the discussions. Also a bit more information about me as your instructor. But I hope this gives you a little bit of an idea of where we're headed in this course. You'll be using one text, which is a handbook of clinical psychopharmacology for therapists. It's specifically designed for people who are in a master's level program, who will not have prescribing rights but need to understand the basics behind psychiatrically active medications. It's a good book. There's a recommended text that for those of you who want to go much more in depth into how these medications work, how they interact with the nervous system, how they produce the results, the effects that we are expecting, and sometimes the side effects that regrettably do occasionally come up with those medications also. So that's mentioned in your syllabus, a great textbook. It's really designed more for medical school level of instruction, but if you're really curious, you might find that enjoyable to get and to look at as well. So I'm going to sign off for now. Look forward to talking to you a bit more soon.